Tamera, good to see you again. So we talked about your foot injury or the surgery that you went through. Tell me what that caused, or what was how going through that recovery started to aggravate other parts of your body.
Yeah, shockingly, after my foot surgery, I was focused on my gait and how I was walking, which was unusual for me too, to focus so heavily on walking. And then pretty soon I noticed that my husband would make fun of me, honestly, about my foot traveling out to the right. And so I could not walk with my feet straight forward. And again, I mean, after working with you, I learned that because my big toe ligament was not working appropriately. So it caused hip pain, and I had hip pain, and I just ignored it. I would try to do physical therapy for my hips just to do corrective exercises to make sure I wasn't off somehow. Okay, and then I'm thinking I'm fine, but we went skiing, and then I tore it. I tore my labrum, and so it took another 2 months for me to actually go in and get an MRI. And once I figured that out, I talked to a friend, and she highly recommended you, and so that was my first visit with you.
We were able to kind of discern that there was kind of more of a chronic issue going on there. Do you remember what that was?
Yeah, which was kind of surprising to me. You pointed out that my SI joint might be off, which honestly, I never considered my SI joint would throw so much off. But that awareness was huge, and I think it's sent me to a place where I could heal. Because if I hadn't addressed that issue, if you hadn't noticed that, I probably would have continued to have the same hip pain, and it would travel all the way down the chain.
So we refer those processes out with the doctor down in Denver, and we encourage a PRP injection. If you were to kind of globally say, kind of going through the process, because we know that can be uncomfortable, how is the overall experience in terms of the recovery for that hip now?
And again, it's one of those situations where you really don't realize how important the SI joint is, and if it's off, how much it throws everything else off. And so just having that knowledge and being aware of that and focusing on, stabilizing the SI joint and really working through that, and then having the healing modalities that you guys used after PRP, it's a game changer. I mean, I can now bend over without my hip catching and hurting as I stand back up. So it's, again, a miracle.